Hello amazing people, welcome back to my channel. Hazel Bulubisi here. If you're new, please make sure to hit the subscribe button, and if you're a regular, welcome back. This week we're going to continue the discussion about diabetes. I decided to do a 2-segment section about this discussion. Last week we talked about the definition of diabetes and the types of diabetes. Then now today we're going to talk about the symptoms and the diagnosis of diabetes. After that, as usual, we're going to have a guest who's going to talk to us about her experience of living with diabetes and what she has learned so far. I'm going to start first by telling you what the symptoms of diabetes are. The first symptom is hunger. Usually we see that these people feel really hungry. This is because, as we said, when you have diabetes, you have a high glucose level in your blood, meaning that the glucose is not going into the cell. So the cells are starved and they have to find another form or another way to make energy. So what they do is they break down fats and muscle, making the patient lose a lot of weight and also feel very hungry, and you will find that these people want to eat because they're constantly feeling hungry. The next symptom that we see in these patients is that they have glucose in their urine. This is because the high amount of glucose in the blood is able to pass through the kidneys and get into the urine. In a normal situation, the kidney usually reabsorbs the glucose from the urine, but because the glucose is in excess in the blood, it will also be lost through the urine. So in this case, because we have high glucose in the urine, and we know that glucose is an osmolytic substance, it causes water to follow in the same direction that it's going. So there'll be a lot of water that is being lost because it's following the glucose. Hence, you'll see that this person will be urinating a lot because their amount of urine has increased, so they'll constantly be going to the toilet. And because they're constantly going to the toilet, meaning they're losing a lot of water, they'll be dehydrated and the body will be demanding for water, so you'll find that this patient is constantly thirsty and also always wants to drink water. So those are the 4 main symptoms of diabetes. Usually, if you suspect that you have diabetes or you go to the hospital and they want to check whether or not you have diabetes, there are 4 main tests that you have to do. The first one is called the fasting plasma glucose test, where we see the patient does not eat or drink anything for 8 hours, then their glucose levels are tested. Usually, a person is considered to be pre-diabetic if their glucose levels are between 100 to 125 milligrams per deciliter, and they are considered to be diabetic if it's above 126 milligrams per deciliter. The next test that you can do is the oral glucose tolerance test. In this case, the patient is given glucose, which is usually 75 grams of glucose that has been mixed in water, so it's been dissolved in water. Then tests are carried out 2 hours after being given that glucose so as to check the glucose levels in the blood. Usually in these patients, if the level is between 140 to 199 milligrams per deciliter, then they are considered to be pre-diabetic. And then they're considered to be diabetic if it's above 200 milligrams per deciliter. You can also do just a random glucose test where it's taken at any time. And this most of the time is done in the emergency setting. So if you're in the ER and you have high glucose on your blood, they'll just randomly check your glucose levels. And of course, if it's above 200 milligrams, then you're considered diabetic. The last test that is usually done, and this test usually helps us see how your glucose levels have been high for the past 2 or 3 months. So it's able to tell for over a long term compared to the other tests, which are just the general short term. This test is known as glycated hemoglobin. As you know from your basic science or biology, hemoglobin is found in the red blood cells and it binds oxygen. But in this case, why we are testing glycated hemoglobin is because usually if you have high levels of glucose in the blood, the glucose tends to bind to this hemoglobin, and you're able to test the amount of hemoglobin that has these glucose that are binding to them. So you're able to tell how much high levels of glucose the patient has been having for the past 2 to 3 months. And for this test, the values are 5.7 to 6.4 grams per deciliter for a pre-diabetic patient. And if it's above 6.5 grams per deciliter, then this patient is considered diabetic. So this wraps up. This is the general symptoms and how to diagnose a diabetic patient. So now I'm going to invite my dear friend who's going to share with us her experience about diabetes, how she felt, how she's been dealing with it, and just life in general. Please welcome Cynthia.
Hi, my name is Cynthia Karwitha. I'm very happy to be on this channel. Thanks Hazel for inviting me. I've known Hazel since perhaps we're in high school, and I'm so glad that she started this platform and that she's supporting diabetes this month, because it's a Diabetes Health Month. I currently work in the not-for-profit sector, particularly the health space. Supporting different health interventions. So Hazel asked me to answer a couple of questions, so I'll read them out and give my responses. How long have you had diabetes? I have had diabetes. I was diagnosed in 2018 of August of 2018. That makes it 3 years this year. How did I feel, or how did you feel when you first found out about it? I think the words that could explain how I felt was 1, anger, 2, I don't know if this is a feeling, but I was in deep denial, and 3, I guess disappointment as well. Anger, because it was not like a very, aggressive type of anger. I was very angry because I had always associated diabetes with, the elderly. So you get such diseases when you're in your late 60s or your 70s and, going forward. You don't, or you get when you're really, really young. So there was no in between. And so being diagnosed with diabetes at a young age was different. It was strange. I didn't understand why I was given such a disease. And for a long time, I called it an old person's disease. Was I knowledgeable about diabetes before, or did I start learning about it when I was diagnosed? Okay, honestly, before I was probably just living life. Of course, I knew there was diabetes. I knew maybe people who had diabetes, but I didn't give it much thought or much time to look into it or to read about it. So I only started reading about it, talking to different health practitioners about it, and watching stuff on the internet about diabetes after I was diagnosed. How did it affect or change my lifestyle? It affected and changed my lifestyle in so many ways. For one, I lost a lot of weight. Different people would see me and would notice and would ask questions about why I had become smaller. It changed my interaction with food. I had to be conscious about eating a healthier meal and, being intentional about my portions. I had to start being intentional about being active. I'm on a journey towards consistency and full-on discipline, but you pick up and you continue from where you left off. It also changed how either people with a disease or people with lifestyle diseases who may be battling, or different, lifestyle diseases or any disease that people may be battling. I think I'm more empathetic because I understand, especially as a young person, how it feels, and that can be really hard sometimes. So I guess that also changed for me. I became more empathetic, I became more sensitive in that light. What have you learned about living with diabetes? You have to be intentional. You have to remember that at the end of the day, the choices that you make may not be everyone's choices in terms of your lifestyle, and that's fine, and that you have to be intentional about it if you're going to live or lead a healthier life, or if you're going to be able to control your diabetes. What do you do to stay positive when the times get tough? Thankfully, by God's grace, I have a great support system in terms of my family and my friends who have been very supportive and are constantly checking in on me to find out how I'm getting on, how my sugar levels are, how I'm maintaining my sugar levels as well. Even to the tiniest questions like, what have you eaten? Or what have you had for your meals this past week and things like that. So I'm grateful to have had that. What advice would you give to other diabetics and the general public about the disease? Let me start with the general public. Truth be told, lifestyle diseases are catching up with us sooner than we anticipated. People are getting diagnosed with, things such as high blood pressure, diabetes as well, and many other things. Young people as young as 24 are dying even from heart attacks. What does that mean? That means we have to be intentional about how we lead our lifestyles. By all means, lead your life and things like that, but you have to factor in that these things are coming sooner. Diseases are catching up with us sooner. If it's actually maybe even in your family, if it's hereditary, and you're not careful about your lifestyle, you could battle it sooner. To other diabetics, I would say, hang in there and have someone that you're accountable to. It would be nice also just to have what I know I'd struggle with, because sometimes you just want to talk to someone who understands how your body feels sometimes, or how your body reacts, and how it makes you feel. It would be nice to have, more support groups, and especially of younger people out there who are battling the same. But we use what we have. So if you can have someone you're accountable to, if you can have someone you're speaking to about a struggle of living with diabetes as a young person, please do. Lastly, what other general life lesson and advice do you have? Sometimes it's hard, but you wake up every day and you need to purpose that you're going to push on. You need to be intentional about that, even on the hard days. And that requires energy, and that requires, like I've said this whole video, intentionality. That requires a good round of people around you to help you to be able to do the same. So it's possible to live with a lifestyle disease, but you have to be intentional about how you take care of yourself now more than ever. Don't be reckless with yourself. It causes more harm to your body than you can even handle. I know we're talking a lot about self-care now, and part of this is, eating or having a good or well-balanced meal. Being active, in that could mean taking a long walk, a jog in the morning or in the evening, whatever suits you best. Engaging in, maybe if you're able to go to the gym, the same, or any other activity that can keep you going. So also having people around you that support you in that light. And lastly, I would say, if you have a loved one or a friend not only struggling with diabetes, maybe they have high blood pressure or any other lifestyle disease that may be cropping in, support as best you can. You might not even need to buy the medication or whatever, but just a simple call to find out how you're doing. Are you still, keeping? Are you still in line with your diet? Are you still keeping active? Are you still maintaining some sort of positivity in life as well? Because sometimes things can weigh you down. So be sure to be there for your friends and your loved ones intentionally. Yeah, thank you.
Thank you, Cynthia, for opening up and sharing with us your experience about having diabetes and how you had to deal with it up until now. I hope that the audience that have watched until this far have learned something today and are able to carry something with them and say they know something about diabetes, or at least now they are curious to go and learn more about it and be able to help the people around them in the community that have diabetes. Yeah, that's pretty much it for today. Thank you for always staying tuned, and see you next time. Bye.